Have you or anyone you know have kidney disease? Then they have been told by their physician that they have to live with this condition for the rest of their life. As when the kidney disease progresses to end stage renal disease, that's when they will be on dialysis for the rest of their life. Today, I am going to introduce you to Sandra, who took control of her health and reversed the condition. Are you ready to learn how to take control of your health, to live a healthier and a happier life? Continue watching this video until the end to learn how to take control of yourself. Sandra Washington is a national board certified patient advocate and the owner of MediHelps. She encourages patients to empower by using their voice. She encourages them to question their providers so that they can take control of their health and have access to optimal health. I am Rajitha Bommakanti, National Board Certified Health and Wellness Coach, registered nurse, culinary coach, and founder of Healthy You Lifestyle Center. If you want to develop healthy habits for life, one step at a time, then click the red subscribe button and the bell icon now. Welcome, Sandra.
Thank you so much for having me today.
I wanted to you to share your story today to our audience about your kidney disease that you have mentioned to me. If you can let us know, how did you get kidney disease? Did the doctor ever tell you what was the cause behind your kidney disease?
Oh, that's a really good question. And no, I've never been told what was the actual factor with the kidney disease. Although I honestly believe I am a diabetic. I'm type 2 diabetic. Metformin for a I've been on metformin for at least 30 something years.
Hmm.
So I've been on metformin for a long time. I, at one point in time, was on metformin and insulin, although now I don't have to take insulin that often. And prior to my CKD diagnosis, what would happen is that whenever my sugar went above 150, I would have to take a dose of insulin along with the metformin to lower it. Currently, with the diabetes, I'm on metformin. It's a medication called Glixambi, which my endocrinologist switched the insulin out for Glixambi. So I'm on metformin and Glixambi. But because I've been on metformin for so long, and because of the reports and the data, the peer scholarly driven data that shows that this is not so much that it's a commonality, but it is something that can happen with you taking long-term metformin. I believe, it's my opinion, that's actually what caused me to develop the problems that I developed.
Okay. So it's just appalling that the doctor never told you what could have been the reason behind your kidney disease. So once they have diagnosed you with a kidney disease, did they say what stage you are at?
I currently am at a stage 3. What I do understand with the CKD is that I was more than likely at stage 1 and 2, and they just didn't say anything because it wasn't that bad, and things didn't get tremendously bad for me as far as the CKD until I want to say it was like December or January, and that's when my endocrinologist called me and stated your numbers are off the chart. You have you were diagnosed with CKD based on my EGFR report, the numbers that they go by. She said you are at stage 3. When I went to her, well, at first I didn't know what stage 3, what stage 4, what all of this stuff was. I didn't really understand what it was, right? It took her telling me, well, it didn't even actually take her telling me. It took me going to being told about a functional doctor, which I now treat with, and I've been treating with her since January, for her to take a look at the labs that I reported, that I gave to her, and say, okay, this is why they're saying this, and this is what this means, but we can reverse it through your diet and through the supplements that I'm going to prescribe for you. She said we could try to see how we can reverse this out so that you don't wind up in the category of end stage renal and needing that dialysis.
Oh, wow. For those of y'all that don't know, chronic kidney disease is where your kidneys are not functioning at an optimal level, where your body is not able to remove all the toxins. Your kidneys is not able to remove all the toxins in your body. So that being said, as Sandra was saying, there are stages, stage 1 through stage 5. So once people get closer to stage 4 and 5, they end up on dialysis. So that is fortunate you found this physician, and also you were willing to take control of your health in order
Right.
to reverse this chronic kidney disease, because for most of them, their doctor does not say that they are able to reverse it. They say, okay, you have this for the rest of your life. You need to
Right.
just deal with it.
Right.
So can you share with us what type of diet changes have you done?
I have had to do a 360-degree diet change. But before I go into the diet change, one thing I do want to make sure that all patients that listen to this, and all providers as well, clinical providers that listen to this, need to make sure that the patient involved, which is the central focus of the care, understands is that they have a role to play in making sure that they take control of their health, that they protect their health. I appreciate the clinical team, whether was the non-traditional and the traditional team. I appreciate them all. But I know that the reason why I did so well, or the reason why I'm doing so well, is because I, as a patient, said, let me take control of this.
Mm.
It took my functional doctor breaking it down to me and telling me exactly why I needed to take control of it. But at the end of the day, it was up to me. It was up to me to say, okay, well, she taking me off of all of this stuff, and I ain't gonna do it, or I am gonna do it because I got work to do and I still want to be here. So for all you patients that are listening, and all you providers, please make sure your patients understand why you're suggesting something to them. Don't just suggest something to them and say, okay, well, I suggested it, without giving them a understanding, and without you asking them after you give them their understanding, do you understand? Do not leave it at a closed answer question, as a closed answer question. Yes, no, yeah, that's not good enough. Push that patient to tell you what they did understand about the language that you told them when you were telling them about their health benefits. Make sure you understand, make sure they understand exactly what it is that you explained it to them. And patience, take it upon yourself to realize that you love yourself. If you have children, they love you, your family loves you. You have a whole circle of life, people that love you and want you to be here. So do what you need to do to make sure you're ensuring that you're here for a long time. Now, with me, as far as my diet, she changed it 360 degrees. First, she started with the pineapple. She's like, you can't have pineapple. Now, I had to laugh because I'm like, but every morning I get up and I have a pina colada. Like, I have pineapples and coconut. Then she got to the bananas. And I was like, but banana pudding is my favorite dessert. So then she got to that. And then she got to the popcorn. I was like, well, I eat popcorn every day. Like, not every day, but I eat a lot. Like, that's my go-to snack. She was like, that's sugar. All them things I'm telling you is sugar. She said, now you can eat it if you like to. It's the decision is yours. I'm telling you what you have to, what you can eat, what you can't eat. I'm telling you. So it's up to you. Now, when I left my first appointment, Then one more thing she told me I couldn't eat, which I love to eat. She told me rice. She said no rice. And so, and mind you, me and my husband both were, well, we were both flabbergasted at the popcorn part. But when she got to the rice, he was like, she can't have rice either. And she was like, well, she can have it if she wants to. It's her life. I'm just telling her what she needs to get rid of in her diet in order to actually be able to function, in order to get the kidneys back up, in order to get the liver back up. Right now, she's at a 0. The ultimate number that we want to see for functionality in both her kidneys and her liver is a 10. Right now, with both places, she's at a 0. So if she leaves here today and says, I ain't doing none of that because that's too hard to give up, then that's her saying, I'm not really looking forward to being here and in life, enjoying life. I'm not looking forward to that. So
You mean to say your kidneys?
right, it was right. Well, no, it was with me. It's both my kidneys and my liver that she saw failing. So it wasn't just the kidneys.
Kidneys.
She said it was the kidneys and the liver. She actually, without even actually without even looking at the lab reports that I brought into her after they finished doing the labs, without her doing that, on my very first visit, she told me what the numbers were. She said, here's where you are right now. Mm-hmm. And so when I did the test and it came back exactly as she said it was going to be, I actually had to take notice and I actually had to stop. And it actually what forced me to actually do what I was supposed to be doing as far as my eating habit and my diet, was that she knew all this just from the exam that she did, then she must know what she's doing. So that's when it was like, yeah, I gotta make this change. It's been rough, but I've gotten to the point now, and she started me on this in January. I've gotten to the point now when I go in the store, I don't even look. I mean, it doesn't even appeal to me. Like I can go down the grocery aisle and know what's in that grocery aisle and keep walking, because I know that what's in this aisle I don't need. I can go in the produce department and pick vegetables and pick fruit that I know that I should be eating because it's better for me. I'm not gonna kid you. I have some times that I've fallen off the wagon, but my body will tell me, daggone well, you ain't got no business doing this. So,
and you learn to listen to your body.
Right. Right.
How about meat?
Meat, she does want me to eat meat, but I don't eat meat. Like I will eat chicken, I will eat turkey, and I will eat certain seafoods. I don't eat pork. I wasn't eating pork prior to all of this happening, so I wasn't eating pork. There's certain meats that I just wasn't eating anyway, but I will eat chicken. She actually encourages me to eat protein, to do the protein. So I will do the chicken, the turkey, and the fish and seafood, but for the most part, that's the only meats that I have. And the good
thing. Share something with you, Sandra.
Yeah.
So the research shows that people that have kidney disease, when they went on whole food plant-based diet, where they were completely off of their meat, their dairy, and eating more vegetables, fruits, whole grains, that's when their numbers went down. Okay. Because in terms of protein, when they increase their plant proteins, that has all the amino acids, phytochemicals, and lots of fiber.
Right.
That's what really enhanced the kidney function.
Right, to make it go up. Right. And so with all things, you got to do baby steps, right? Yes. You got to do, you can't, I mean, there are probably people that can do this, like a cold turkey. I'm not going to do it because I know people that smoke and have done it and said, I don't smoke no more. But it's all about the individual, and it's all about what they decide to do, what they decide. So the fact that I'm, and I do understand that because I took a class not too long ago that encouraged only plant-based. And I have one of my board members is actually a total vegan. So she does no meat. So, and she encourages me all the time, girl, you need to stop. You don't need that. Go, There's so many different things that you could do that you don't need meats on. No, you don't need meats at all. I don't do any dairy. So, I mean, I've gotten rid, well, I actually wasn't doing dairy before. For me, my weakness is the meat. I need the chicken, the fish, seafood. I need to eliminate that as well, but I haven't. And I don't want a patient to say, oh, well, I can't do all that, so I'm just not going to do anything, because you have to do what your limitations are. But you gradually need to start removing removing that stuff out of your system.
Yeah, yeah. How about alcohol?
I don't drink.
Okay.
So
Okay.
I'm good with alcohol. So I don't drink. I don't drink. I don't do dairy. I don't do dairy at all. My chosen, when I have to have something, I'll do like almond milk or oat milk. I've actually grown accustomed to oat milk or coconut cream. Um, I've chosen to do that with the fruits. It's been recommended to me, and I've actually done really well. Like I said, I was at one point in time doing a pina colada every morning, a pineapple, some bananas. That's what I was doing every morning. In the winter months, what I was doing, and I realized how I was hurting myself. In the winter months, what I would do is I would actually have hot cereal in the morning. What I didn't realize with that hot cereal I was eating sugar. I was basically eating hot sugar. So I've since January, what I've done was I gave up the banana, I gave up the pina colada, I gave up the banana pudding that I love so much. But what I've done was I found doing mixed fruit. So I'll do strawberries, raspberries, blueberries. I'll get the mixed packs from the store. I do that. I do spinach, kale. I do the super greens every morning with either some water or some coconut. Was always water, but I'll put some coconut cream in there, and I'll do like a small thing of yogurt I'll add to the smoothie. And I've actually done that. I do that just about every day. I do that. On the weekends though, I'll have like 3 protein pancakes or something like that. But for the most part, that's me changing my diet because I saw the need to change my diet, and I saw how it was helping me in changing my diet since January when I got diagnosed with. And I did ask my endocrinologist, so I don't want to make it seem like I didn't ask her, because I did ask her when she called me and told me, and I brought the supplement. Funny. I brought the supplements that the functional medicine doctor gave me to my appointment with her. She said, I don't even know what this stuff is. This stuff can mess up your diabetes. You might have to come off of your diabetic medication because you're taking these supplements. What's in these supplements?
This is your medical doctor.
This is my endocrinologist that's asking me that.
Endocrinologist.
Now, I understand why she was asking me that, because there was a point in time a couple of years ago, I had death back to back to back in my family, and my numbers, because I wasn't taking care of myself, my numbers shot up to 8, 9, and so that's extremely high. So I was in really bad danger of something extremely happening to me, as far as health wise.
8, 9, you're talking about your A1C.
Right, my A1C was up at the 8s and up at the 9s. So I was out of it for a long time, and she got me back to a point where, okay, well, it's coming down, but we need to come down some more. To now, okay, well, I found this functional medicine doctor, and I'm just gonna follow what she's telling me to do. It kind of like took her by surprise, like, but I don't even know what this stuff is. Do you know what this stuff is? I said, I don't know what it is, but I know that it's working, because I immediately saw the difference between me taking metformin every day and me taking the supplements that the functional medicine doctor was giving to me. And so I saw the difference, and I was like, well, let's just see, take the labs again in 3 months. Let's see what happens. If the numbers go down or they go up, let's see what happens. Well, what happened was I lost 20 pounds. I lost a lot of weight, but it was good weight loss. I lost the 20 pounds. I was at a 31, an EGFR of 31 when they first diagnosed me. My numbers in June was a 41. So,
About
30,
10. You went down.
Yeah, and so it went. It is going. Everything is going in the right direction. My cholesterol, everything was off the chart, and it was like, okay, well, since you're doing this well, keep going. My A1C was a 6, so that means I'm almost at the level where I'm pre-diabetic, where I would be considered pre-diabetic because my numbers are so low.
Yeah.
And I knew what did it was one, first of all, and more importantly, prayer. Two, I, as a patient, understanding the healthcare system, decided when I was given an option and said, hey, you can keep going to your doctors and let them put you on all this medication that's not working, or you can try a different alternative to it that would work. And if it doesn't work, guess what? Stop going. Go back to where you was going before. But why wouldn't you take an option like that and see what it does for you? And many patients don't realize that there are options out there because they're just not told about them and they don't know who to go to, who to ask. But there are options available to each of us. And if and like I said, when my endo and my primary first found out that I was seeing a function, they weren't on board with it at all. And I had to have a conversation with them where I told them, look, I'm the patient. I need to be doing what I have to do to stay here on earth. You guys are the doctors. Y'all need to be getting this together and then coming back to me and telling me what, right? Work with each other. Stop being so against, the practice of functionality and acupuncture. Stop being against that. Because long time ago, before we even had this new wave medical system, guess what? My mother, my grandmother, my great grandmother, guess what they was doing? They was going out into the field, picking shrubs, picking earthly, and that's how they healed themselves. So why can't we get back to that? There's a happy medium. If both of you guys work together, it's a happy medium for the patient and improves a win-win situation. So that's
That is
what.
about taking charge of
Right,
your health, not just blindly following what your
right,
provider is telling you,
right,
asking questions,
right,
being curious about it and understanding. If you don't understand, ask again. If they don't explain to you, maybe that's not the right fit for you,
right,
and going to somebody else, looking at the research. And not everybody can do it completely on their own, like you did.
right,
Majority of them do it for some time and then reverse back. That's when they need a coach to help
right,
them, get them through so that they can make these slow changes one step at a time, like what we have just talked about, this whole food plant-based diet, and also increasing your activity level, decreasing your alcohol consumption, um, movement is a
right,
is a big thing. All of these things, and especially the belief and the spirituality, that the belief that you have in yourself, all of these are various components. Sleep is another big thing. We ignore sleep quite a bit. We think we don't need enough, and we just keep going, going, going. That
right.
sleep affects all the different systems in the body. Our
You're
body is one unit. So, one thing, you were looking at your kidney disease, but all the other things came down. Your cholesterol came down, your weight went down, everything happened because it's all one unit. It's not like medicine. You
right,
have one medicine for diabetes, one medicine for kidney disease, one medicine for high cholesterol. This is like, whole
right,
approach.
right.
Um,
Exactly. And what another point when you said sleep, when I when I first went to Dr. Stacy, she asked me, after she did the exam, well, before she did the exam, of course, I had to fill out the new patient. And I told her I was sleeping 3 to 4 hours a night. And so after she did the exam, she said, I'm gonna ask you a question. I want you to be really honest with me. And I said, what is it? She's like, are you sleeping at night? Now, normally the doctors want me to come out and tell them, when they say what's going on with you. Oh, I'm not sleeping. She automatically picked up on the fact that I wasn't sleeping. She
mm,
said, how many hours a day did you say you were sleeping? And so I said, well, I said, she says, never mind, I see it on this report, but I know that's not how many hours you are sleeping. What I was actually doing prior to actually going to start treatment with her is I would get in the bed and I would lay in the bed and my eyes would be wide open. I wasn't sleeping at all. I had lost all sleep functionality. I maybe on a given night, maybe got 30 minutes of sleep. And then I was right back up at it again in my body. And I was like, and I can't stay woke. The computer looking at me. I'm looking at the computer like, we're like, the computer's like, well, you got to do something in order for me to work. And I'm like, well, you got to work in order for me to do something. I mean, it was just that it was just the lack of sleep had literally clearly wiped me out. And it wiped me out because I wasn't listening to my body. I
Mhm.
wasn't saying to my body, okay, I hear you. I know, I know that I should be up. I know that I should, but I don't really, I really can't hear you. I just didn't have a functionality about me because I wasn't sleeping. And as a matter of fact, at the time, I was actually also seeing a therapist, a mental health therapist, because I just started going through some stuff, some really bad stuff. And she was like, you're not sleeping. So how do you expect to continue to live? Like, how do you expect to continue to be able to give? And don't you realize that because you're not sleeping, this is why you're going through these changes right now?
Mhm.
So, but I wasn't really paying attention to my body. I just really wasn't, until I was introduced to the acupuncturist, and he was like, yeah, there's something else going on here. He's like, you've been with me for a month, you should not be in the same pain. I would go in, he couldn't touch me because I was a ball. I was like a ball. I wasn't a human. I was a ball. He couldn't touch me. And even when he started to manipulate me, tears would start coming out my eyes. He's like, something ain't right. You need to go back and tell them that they need to do some more work because something's wrong with you. It wasn't until they got involved, when I say they, the functional and acupuncturists got involved, that my primary doctor said, okay, well, if this is what they're saying, let me run some additional tests. I mean, it just, and there was points where I'm like, okay, well, somebody dropped the ball because somebody on my medical team should have told me that this is what is going on with your body. Nobody told me that. No, absolutely no one told me that. So, and you're right when you say that not all patients have the resources or think that they have the power to make these changes on their own. And so you as an executive health coach, there's, and me as an independent board certified patient advocate, there are other advocates out there that people can turn to and say, hey, this is what's going on, but I'm not sure how to handle it, instead of silently sitting by and just watching as your life goes from good to bad to worse. Because when it gets to worse, it's much harder to get it back together again, especially if you don't think that your voice matters. If you don't ask those questions, I'm with you. I tell people all the time that I talk to, look, if your doctor is not answering your questions and the way you're looking for them to answer them, and you're leaving your doctor's office and you still have questions and they're not answering them, you need to start looking for another doctor, because you don't have the correct medical team. As I stated to you earlier, I went within a year. I don't think I brought this up, but within a year, I actually went through 3 doctors who I trusted, who I had been with for such a long time, because I told them, you guys, I'm the patient. It's my job to get better. It's your job to look at the notes and labs and everything and decide amongst yourselves what this patient needs to get herself back together. And that's what I need from you. And if you can't do it, I gotta let you go, because you want to play in the playground by yourself. Meanwhile, my life is like not in the playground by itself. But I had to do that, and all patients should do that, because no doctor knows everything. And
Yeah.
if you're with a doctor that says they know everything, that's your first indication that you actually need to be out. That's your first thing. If your doctor's, well, I know everything. Yeah, no, there's no doctor that knows everything. If you're with a doctor that says, well, no, it's either you do it my way or you need to find another doctor, then you need to take the choice of finding another doctor and finding one that you feel comfortable with talking to and having, a patient doctor relationship, because you need to be able to talk to your doctor and your doctor needs to be able to talk to you. It's a thing called patient centered care, and that patient centered care, that's what it's about, making sure the patient is the center of that care.
Yep, I totally agree. And thank you for sharing your wonderful story here. And I applaud you for taking control of your health and really helping yourself. You're not only helping yourself, but everybody else around you.
Not a problem at all. It's all about making sure patients understand that they're worthy of getting the best healthcare ever. So I tell people all the time, patient education equals patient engagement and patient empowerment, which ends up with the result that we all want, which is the best outcomes ever. So I appreciate you for, having me come on and having me share my story, so that patients that feel as though there are no alternatives, there are no options, know that know that there's a way that they can actually reach out. They can reach out to yourself, they can reach out to me. My website, www.medihelps, which is MEDIHELPZ, .com. They can also reach out to me through my Facebook group. We have a Facebook group. It's called The Patient's Voice, and it's a place where patients can come, learn, and share about their different, health diseases and their health conditions, and ask questions. And so it's all about making sure all patients are engaged, empowered, and educated.
I am your faith based holistic coach. Until next time, what is the one micro habit change you're going to make starting today to take control of your health and well being? Comment below.